The Navigating PVS podcast is for general knowledge and does not constitute medical advice. Please consult with a qualified healthcare professional for any health concerns. I'm Jen Joly. I am here with Liz Poe. Liz and I met early on in Summer's journey by way of the Lady Josephine Foundation. That's how I know Liz, and I'm fascinated by what Liz and her husband Ben have built and really respect what they do. And this will be another great story for the podcast.
Yes. Hi, Jen. This is so cool to have this platform. And I just kudos to you for starting it and for just taking this leap. We've been in a similar boat of being called to something and having a lot more questions than we felt like answers, but we just did it. So this is really cool. I think this is an amazing avenue for us as PVS families to connect and share our stories. So I can start with mine. My husband and I have been married about 16 years and I'm a nurse. And so I was working in the hospital and we were doing quite a bit of traveling and just enjoying our 20s. Honestly, we had our first daughter and I was transitioning at that point. I had gone back to grad school and I wanted to work maybe not in the hospital setting. As we all know, any PVS family listening, the hospital is a stressful place, not only for us as patients and families, but also for the nurses and all the staff. And I just sort of knew that my time there was ending. And so I went into primary care, private practice, and I am still there. It was a lovely transition when we welcomed our first. She is now 10. And we also always knew that we wanted to homeschool. We bought 10 acres of land here in Georgia, and our goal was just to be a homesteady family with a handful of kids. And, here we go. So as the story unfolds, we have our second, and then very quickly, we're pregnant with Josephine. So those two are 13 months apart, and it was a very busy time. And that's also when I just knew something wasn't quite right. Like, okay, gosh, I've fed two babies before. Like, I kind of do this for a living as a pediatric nurse practitioner. Something isn't quite right. And I met with lactation consultants, did all of that. It was I would say, a very wild 7 weeks. We did not know anything about Josephine's medical stuff until the 7-week mark.
So nothing, you had no idea. There was no cardiac diagnosis. There was any diagnosis.
Nothing.
Wow.
Yeah. And we did the standard 20-week ultrasound, and which our cardiology team did say like that they're not surprised that the pulmonary veins if they weren't really looking for that per se, and there wasn't anything else that would make them think to look more, then
Well, and they're so
they wouldn't
tiny,
have.
right? Like
So tiny. Yeah.
how would you expect a
Yes.
ultrasound, at that stage to show, right?
Yep. Yeah.
That's what makes this so hard.
Right. Yeah. So long story short with that, we ended up in the ER for sort of a failure to thrive workup. And the ER doctor heard a murmur, which I don't think anyone heard one on her yet. I don't remember them saying anything. I knew she was going to get a feeding tube. Like I knew it in my gut. And I almost really wanted one, even though I had zero idea what was going on because I was working too hard. I knew she was not getting what she needed. We had to figure out what's going on. But it really didn't take long to figure it out, right? So by that morning, we had an echo and a cardiologist walks in our room, and it is a dear family friend of ours who only is on call at the hospital, I don't know, a couple times a month. So it was as if that was planned where he delivered that news to us.
Yeah.
Of we've got some heart stuff going on. And my brother was in the room with us just visiting, and they were really good friends, my brother and Dr. Iannucci, the cardiologist. I felt like we had someone on our team already that knows me and my family very well.
Right.
So as much as we get thrown into this cardiology world, that was just such a blessing in our eyes. And he has helped us tremendously. He is our go-to if we're really in a dilemma or really in a decision mode where we don't know which way to go. We usually call him. A couple of things he told us right off the bat. He said, please don't go Google this. Which
I wish I had been told that. Yeah.
I did not. And I'm so glad he gave me the permission to not do that.
Yep.
So she will be 6 in June. And back then, there wasn't a lot of great information. There was not a lot of centers, at least, that had even PVS programs or pages up to even give you any info.
Had he heard of PVS before? Like, did he have any experience with it?
He had, maybe just because of where we are in Atlanta, and it is a very big sort of established heart center that like lots of complex heart kiddos, and they're pretty well known for a lot of the different heart surgeries and stuff they do. So it was just something that he had definitely heard of and knew enough to say, like, let's be cautious with how we talk about this right now and what we're going to do. And he drew out the heart for us on a paper napkin in the room.
Yeah.
And I still have it. Actually, I have it in her little binder. It's literally like a napkin from the dispenser thing in there to wipe your hands. And it points to the pulmonary veins and it says, mild pulmonary vein stenosis. This needs to be watched carefully. Because we only had the echo. We didn't have anything else like a cath or anything at this point, right? And so I think he knew from his clinical judgment that was going to be our major thing. He said, we need to do a CT to figure out a little bit more of what's going on and decide. And so very quickly.
And was that the only diagnosis at that stage?
She had like really, really minor other little things that I think that if she didn't have PVS, we wouldn't really be talking about them that much.
Okay.
From the way they made it seem.
You get the napkin.
We get the napkin. She got a brain MRI and that was normal, and had some labs drawn and just the basic genetic stuff, and that all looked normal. So we were able to close that door. And as she's grown, there hasn't been any evidence of anything else. So she's also unique in that she really just has PVS, which, you know, a lot of other kiddos maybe have something else going on, whether it's another cardiac defect or a syndrome or anything like that. It left us with like, okay, well, but why was she born with just PVS? That's very interesting.
Right, because Summer and Josephine were both born at 36 and 5. Like,
yes,
almost full term.
right.
You get the benefit of the preemie diagnosis by 2 days. Summer's got septal defects, but these are full-term babies pretty much that have this severe PVS.
Yeah.
I don't know the data points, but my impression is that many kids that have the PVS diagnosis, they're significantly premature, not
Right.
2 days.
Yeah, exactly. Right. So it's kind of like, do we even really fit in that category? I don't know. But yeah. And so, it was an interesting, very challenging beginning part to her life because, like we've talked before, Jen, that when we come home and we're kind of in our next steps of like, okay, what's next? I have a 4-year-old and a 1-year-old. And I'm 7 weeks postpartum. So that's always just a little challenging, anyways, as we all know. And at this point, I'm supposed to go back to work at 12 weeks, only 2 days a week. But, life just halted, right? And we have an amazing community down here. And so that's always my hope for everybody. Like, I know that's going to look different for everybody, but I think going through this, my husband and I we knew that can just change the shape and the way that we will tell our stories if we have support. And we're going to need it in different ways, right? So we've had to travel for care. I mean, I hope that a lot of people don't hear coming up soon. That would be lovely. And I do think that's more likely now than it was when we were first diagnosed. But
it's even more likely now in the 3 years since Summer got diagnosed.
Yes.
The trajectory has changed. And you probably also heard at the symposium, the average PVS family travels 950 miles for care. Like, that's crazy. So we did 1,400 miles to Boston.
Okay.
And now I think we're roughly 400 to Chicago. And I can tell you that 1,000 miles closer is life altering in amazingly positive ways.
Yes, absolutely. Yeah. And that was another thing we faced was, so our timeline is we go to the ER, we get admitted, we get an NG tube. The CT scanner was down at the time.
You have to be kidding me.
Yeah. So he was like, you can go home for a day or two and we'll bring you back for that if you feel comfortable. And I'm like, that's fine.
Are you scared to bring her home though?
Well, I knew I had the NG tube and I felt fine with an NG tube. That's what I have done for a living.
Okay.
And I knew at that point that she was stable
So you have the
because
benefit of like you have worked with kiddos that have NG2s. This is not foreign to you.
right, right. So I think that, and in my mind, that was actually a huge blessing because it enabled us to actually go home for almost 48 hours and just comprehend all the information we were given.
Did you
And
sleep?
I have no idea. I don't think I slept for a year and a half. So,
Yeah.
so my answer is probably no, I did not. Um, again, the feeding tube, the pump, all that is fine. Like I felt there wasn't really a learning curve there. Now I helped teach my husband, but he learned it very quickly and honestly became just a pro at it. So that was amazing. But gosh, even at that point, I feel like she was still in like syringes, like it was so tiny. She did fine for those couple days. And so we went in for the CT scan. And of course, the cardiologist is right there watching it. And I can tell he's walking toward us. I'm like, okay, I don't know what he's about to say. Her two right pulmonary veins actually never attached to her heart. So they just became atretic. I could see it. Like I eventually looked at some of the pictures and stuff, and they just never attached. It's like they really tried. They were right there. And
Wow.
her left two came into a common vein. And so she essentially just had one pulmonary vein.
One pulmonary vein.
Like the two left came into one, and the one was attached to her heart.
And that's it.
Oh, and that was it.
So for
And
7 weeks, this child is surviving with
yes.
one pulmonary vein.
Yes,
Wow.
which is just amazing.
Yeah.
So she's in the cath lab within 48 hours. And two of the cath doctors who have seen pulmonary vein stenosis, it is not foreign to them. They have done caths on these kiddos. So that was reassuring. They were in there a long, long, long time and came out and said, we tried everything we could do. We could not get into those veins. The hope was that they could still get into the right veins, that just the images gave them a good idea, but maybe there is a connection and they just need to go in and open it up, right? And that did not happen. And
Do you
so
remember how long she was in the procedure? Do you like,
it was at least 6, 7 hours at least, maybe.
yeah.
It could have been longer. It was long. And I remember just thinking, I have no idea what's next. I don't know what that means, because they were here telling us like they tried everything they could in cath lab. They cannot do anything in the cath lab. They were very hopeful. And my husband and I remember them saying, we're not going to give up. And we're going to, I don't remember their words exactly, but what we left with was they're not telling us that there's nothing to be done. However, there wasn't an exact plan. So we go back to the ICU. It's like crickets in there. Nobody's talking. They keep saying the surgery team is looking at her case and they might operate later this week. And we're thinking, okay. Again, this is so new to us. I'm thinking, what does that even mean? Like, what are they going to do? And again, nobody's saying anything. And we're like, this is so weird. It's like they didn't know how to talk to us or something. I have no idea. It was very odd. And having worked in the hospital, I'm thinking, okay, I feel like there's a better way to go about this, but I don't know. We're just going to wait this out and see. So they finally say that surgery is not an option at our home hospital here in Atlanta.
Okay.
And so that was obviously very devastating news because the impression we were given was we need to have surgery to have a chance here. And so again, it's crickets, nobody's talking. And I don't remember all the details, but I do remember thinking, well, can you get second opinions? Like, don't you ask other people? Don't you call a friend and say, have you guys seen this? What would you do? And so, of course, we call Dr. Iannucci, who is our dear friend and first cardiologist, and he sat down on the phone with us for an hour, talking us through, absolutely, you ask for a second opinion. We do it all the time in the cardiology world. It is not a negative thing in the sense of you're not happy at your home hospital sort of thing, and they're going to be upset with you because you do feel that pressure of like, well, I want to trust them. I know this is a wonderful facility that we're at, but it does seem like there's something missing here. So we bring it up and to the ICU attendings and they say, yeah, that's very reasonable. We'll send your stuff to Texas and Boston. And I assume at the time, those were sort of the two most established PVS programs, which, I
Well,
realized today.
even 3 years ago when Summer got diagnosed, same setup, right?
Yep.
I mean, the home hospital had a relationship with Texas, so they said we'll facilitate, we'll get the second opinion going there. We went out and filled out the second opinion information on Boston, right?
Okay.
So like, and maybe in the 3 years between when Josephine was diagnosed and Summer was diagnosed, I feel like maybe the second opinion portals might be a little bit more, patient driven, right? Or family driven.
Yes.
Like we felt very comfortable if they're going to go get one from Texas and they've got the relationship, well, let's see what Boston has to say,
Sure.
right?
Yeah.
So,
Yeah.
and at that time it was still very much like if you were going to go anywhere, you're going to go to Texas or Boston.
Yes. Yes. That was definitely how it was for us. And so Texas pretty immediately said no. And Boston called us within a couple of days and said, you need to get up here by next week. And they had this opening in their schedule, but they also knew like this is a time thing. She needs to be up here immediately. So I was too scared to get on an airplane. So we drove to Boston, Atlanta to Boston.
How long is that
Um,
drive?
it took us about 24 hours. Some of our best friends live in Richmond, and we made a stop there. And then I think we drove the rest of the way. My brother-in-law is amazing, and he loves to drive and do road trips. And so he drove up with us.
That's
And
amazing.
so he drove us most of the way. I'm here like pumping and tube feeding in the back seat the whole ride up there. It was
Yep.
wild. But I knew we're never going to get there if I don't just like continue doing this. So,
So can I ask, so we, not our initial trip to Boston, but our second trip to Boston, we also drove. It was also 24 hours. How much? So Josephine has an NG at this point. When we made the drive to Boston, that preceded our failure to thrive diagnosis. And the clue for me was that Summer was throwing up the entire way from Minneapolis to Boston. Is Josephine throwing up frequently at this point? Like that's a whole big
no, she
area.
wasn't.
Okay. Okay.
She was actually like, we kept saying, gosh, she's just a chill baby. But looking back now, I'm like, oh, she just was really sick and
Hmm.
she was tolerating her feeds, but she did not have any energy.
The puking was always kind of there. Flew to Boston, we started treatment, came home, and then we drove back. And that's when things escalated. So, for Josephine, I don't know if it's similar to Summers. Once we started tinkering, that's when the
Yeah,
throwing up started happening.
that's interesting. I should look back. I actually started a caring bridge, and that was a huge blessing for several reasons. But one, I can look back on things and say, oh, when did this happen or that? It was almost like things are time stamped in that journal, which is lovely
For
because
sure.
I for a long time I did not keep good sort of notes and documents of things. And I think that was just part of my coping, right? If I didn't absolutely have to, I wasn't going to.
Yeah.
And so, yes, I would love to look back and see when did all the, especially the vomiting really happen. I want to say though, like probably after that first surgery in Boston, she had a cath the day we got up there essentially, and she was in the OR the next day.
Oh,
So
wow.
it was
Okay.
very fast. And I think they knew this is very much a time sensitive thing.
So
And
she's had two caths already by the time she has open heart surgery. Were they able to intervene at all, or did they need to intervene? It was just
no,
exploratory for the most part.
essentially, yes. Up in Boston, once they did the cath there, I think he just ballooned open that left common vein just to in prep for knowing it was surgery the next day, but there wasn't much to do,
Okay.
honestly, at that point, because same story up there, they could not get into those right pulmonary veins, which is what Dr. Baird did. He reattached those 1 millimeter veins and put teeny tiny little stents in, and she did wonderful. So our story is a mix of Gleevec for a little bit, sirolimus for a little bit, stents in every other cath, that whole all the words that all of us PVS families are probably very familiar with. And at 18 months, they realized down here in Atlanta that her stents were causing more problems now that she was bigger.
Okay.
So they were life saving for that first year.
Yep. Yep.
but they were just so tiny that they weren't, and they could not fracture them open, that we couldn't sit on these for too long. So we ended up back in Boston and had surgery right around that 18-month mark. We say he took the stents out, which is essentially what he did. He sort of had to leave a little bit of the hardware of the stent in there for just the integrity of the vein. But she really, at that point, would not have been considered to have any stents. And since then, we went several years with no stents and just ballooning during caths. And
How far are you getting stretched apart?
we went from, after the first surgery, 4 weeks, then 6 weeks. I think we had several that were maybe 6 weeks apart. And then 3 months, had a couple that were 3 months. And so I would say by 2, that might have been when we were at about 9 months.
Okay.
And we were at 9 months for several in a row. The goal is always a year. Like, we felt like that was our goal. We can do this. I think I just need a goal. I need something to work toward. I need, and I want that for her so badly that it feels like, okay, that's what we're going for. And, of course, we only have so much control over that at home, but it felt like, okay, when we get to that, like, we're really winning. But then I realized that's probably not the best way to look at it. And I think her team has been the most encouraging with that, because when they brought up, like, she may need stents again. I mean, we thought, oh my gosh, we've worked so hard and we don't want a foreign body in her body. Like, she already has all this other stuff where, like, our goal was just keep those out. And now I sit back and think, that wasn't the right thing for her. She needed the stents. She got them last year and she's been thriving. She's had, like, her best echoes and her best follow-ups with these stents in, but they're bigger stents. She can grow up with these. It's just a totally different story. I was tunnel visioned on it, right? I thought, okay, this is positive, this is negative. And now when I think back, that just made it almost more stressful for me.
Right. You're just in your head, you're equating stents are bad, no stents is good.
Yes.
Longer intervals are good,
Yes.
shorter intervals are bad. But yeah, you have to kind of accept what they need at that moment, right?
Yes.
And for Summer, stents have been a huge blessing to finally get us stretched out. I mean, we were still at caths every 5-6 weeks, all the way up until, was she 14, 15 months old?
Okay.
Right? Ciro has been the game changer for her because she had stents and Gleevec, and we just couldn't really get out of this vicious cycle, would need the IV diuretics just to get by until the next cath. I mean, we're stuck in the hospital for 6 months. The stents are a blessing, but also we deal with tons of in-stent stenosis right now.
Right,
So
exactly. Yeah. And so again, every kid I know is just on their timeline of when they need things and when they don't. And I do think we let her grow a little bit and we were able to schedule her caths where we didn't wait too long, but we didn't go too soon. It went very smoothly for a couple years. And then we were able to have a couple long discussions with our cardiologist before the next cath of, like, here's what I think is going to happen and here's what could happen. And we ask a lot of questions and they are so lovely and just entertain all of them. And he got into the cath and he said, I didn't have to decide anything. She decided for me. She needed stents and I knew it immediately. Her pressures were just so high and there was no decision, right? Which, that's what we prayed for, honestly, was just make it clear. Just make it very clear what is supposed to happen so nobody feels this wishy-washy, should we do this? Should we do that? And ultimately, we'll see. We have a CT this summer, and my hope is that it looks great and that we can make it to the year. But I also am completely ready for whatever the interval in between there is, and that's going to be okay too. And, to kind of step back a little bit of having the other kids, because I went way into just Josephine there, which is okay. But we had a really good cath doctor down here in Atlanta. But once he left Atlanta, it was so sad. I just thought, how are we going to do this? How? And in my mind, like, I knew other families traveled for every single cath, but I thought, I can't do that. There's no way. They're like, how? just logistically with other kids and all of this. I think the huge blessing out of that was we knew that the next cath was going to be very determinant of, is she going to need surgery again? We didn't have surgery on our radar. We hadn't really talked about it. But at this point, when that Atlanta cath doctor left, she still had her original stents in. And so it brought us back up to Boston to have a cath up there. And I think it was a familiar place, right? We've been here before. It's not completely foreign. Yes, we hadn't have to come for a chunk of time, but we can do this. We are travelers. We know how to do this. She's older now. Things aren't quite as crazy, even though they were still pretty intense. And we were able to leave our big girls at home with family.
Yep.
But man, that's hard.
Yeah,
It's
I
really
can't
hard
imagine.
because you feel, I never felt the sense of abandoning them, right? And I could see how that might be felt. But I felt like I was going to miss things, and this is a lot for them. They can't really piece together what's going on if we can barely piece it together. My oldest had her first day of pre-K and we were in Boston, and I just thought, "Oh my gosh, I am supposed to be taking her there." You know?
And there's the guilt side of it, but there's also just the longing to be there.
Yeah.
My husband and have been together for a very long time, and my sister-in-law was getting married 2 summers ago now.
Mhm.
And Summer had just gotten airlifted from Boston to Chicago. I had been feet on the ground, like 36 hours in Chicago, and I'm looking at flights thinking, I don't want to miss this wedding, but I thought, how in the world can I leave Summer here with a team that doesn't really know her? Her
Yeah.
pulmonary hypertension at this point was so bad. I missed the wedding.
Yeah.
Right. And
Yep.
and so you look back at pictures of your daughter's first pre-K. I look at pictures of my sister-in-law's wedding, and it always does bring this feeling of like guilt, remorse, sadness for the things that you give up.
Yeah.
But they're the right things.
Right. And I think it's all perspective. And now I'm able to look at it and say, okay, I wish I was there. But that's just parenting, I think,
Yep.
right? Josephine will be 6 and we have a 1.5-year-old. And I was reflecting the other day on any postpartum time, I have missed out on things with my other kids.
Yep.
But that is just the nature of having a newborn. And yes, some mamas can get out there and they're at the soccer field 48 hours after giving birth and all that. That is not me. I am a let me stay in my house for a month and I'm fine with that. But what I've learned through that is what I do have control over is making sure my kids are cared for and loved and still feel connected to us. So we tried things like scheduled FaceTimes from
Yep.
Boston to Atlanta, right?
Yep.
And we would go to the little library in Boston and we would get a book and we would read them a book over FaceTime, right?
That's
And that was,
what a
and
wonderful way to connect. And
yeah, they loved it. They absolutely loved it. But it gave us something to do and it was short because a 4-year-old and a 1-year-old on FaceTime isn't going to last super long, or they ask the same questions over and over.
do they connect to this higher purpose, this need for mom and dad to see Josephine through this huge, really complex health crises? And do you think as they've gotten older, are they more or less connected to that? Do they understand it?
Yeah, well, and it's interesting because she was born in 2019. So we already sort of like didn't go anywhere for a year. And then, of course, everything sort of shuts down for the next year. My hope was that they could at least come to appointments and come see her after a cath and all that. But of course, nope, nobody can visit. That was really hard because I'm
Mm-hmm.
thinking, how? They just kept asking questions like, but where is the hospital? What kind of bed is she in? That's the curiosity that a sibling has.
Yep.
In my heart, I was like, you need to be here. And child life needs to be here with you and help you walk through this as a sibling of a kiddo like her. So at some point, I think it was 2021, she was in the ICU after a cath, which was standard for her just to have observation and whatnot. And they did allow our oldest to come and see her. And so that was just awesome. And then we took a picture of her just looking over Josephine on the crib, because of course Josephine was not awake. But that, I think, helped me realize that they need as many connection points as they can. Every kid is going to be a little different, though. Some can handle more things than others, as far as just the intensity of things, maybe. One of mine is there's a tiny bit of blood, and she's kind of, oh my gosh, I hate blood. Being mindful of that. But I talk to Child Life all the time about it of, okay, do you have any suggestions on here's my other girls' ages? And there are some things I think resource wise for families and for siblings, but it's hard when they're that young.
Yeah.
I feel like that's a little more geared toward when they're a little bit older. So I knew we had time there and we needed to figure out how do we do this. So we actually go to CHOP now in Philadelphia for her cats. We followed her calf doctor there, and we brought everybody her last calf.
Oh, cool.
We
That's
all
awesome.
drove, and we had talked about it for a while of we really need to take everybody, right? Like this, we're a family, and this is our, as we say, like this just is our normal life now. This isn't, I mean, someone else would look in and say, "Oh, that's abnormal." Like
Yep.
you have all these hospital visits. Most
Yep.
are scheduled at this point, but this is our normal. And so how are we going to keep proceeding with this if it's just leave the kids at home, say bye, go do this thing and keep it disconnected? So for us, it was really important to figure out how can we stay connected and let her siblings be a part of this.
For sure.
And it was wonderful. Like traveling with kids is just a challenge in its own
Yep.
when you're having a fun thing. So I think if like we're able to peel back that layer, then it's okay, we can do this. It was a lot of shuffling and this and that. And of course, they can't stay in the hospital. So it was like, oh man, do we even bring them? And you're like, nope, we're going to figure it out. We're getting them in there.
That's great.
And we did. We were able to get them in, and they let us bring Josephine out into the hallway in a wheelchair, and they could see her out there. They didn't want them to come in the room, which is whatever. Okay, we'll make it work. So
It's just such a great example of where it is okay to ask for accommodations to support your family because the PVS experience is so unique. I think it's funny you said somebody else would look in and like this is abnormal. When we go to Chicago, we try to make a trip out of it. I mean, my husband and I use our, like I'm freelance, but that's his time away from work. So
yeah,
we're trying to make it meaningful. It's about a 7-hour drive with a toddler. And a few trips ago, actually last summer, she started to figure out like the jig is up. We're halfway to Chicago, and she is clearly advocating non-verbally, advocating to get back in the car. She wants to go home, right? Like she knows where this is heading. Part of it is just trying to like mix in the memorable good with the trauma
yes,
that they're going to have to go through. At Summer's last pre-cath appointment, I advocated, can we have a morning appointment so we can have the afternoon to go to the Shed Aquarium and do something fun before she has to go experience more medical trauma. I think for your other children and for Josephine and for kids like Summer, it's like we have to figure out how to live our normal,
yes.
which is like looks absurd to anybody else.
Yes. Yeah, absolutely. It's very unpredictable and it often requires travel. But we've done the same thing. So when we brought them up there to Philadelphia, we did that early morning appointment and they were able to kind of be in the hospital, but not really with her in the appointments. And then we had the whole afternoon. We went to one of the children's museums. They had a blast and went out to eat and just made it fun and
Yep.
had all four kids stay in the same hotel room, which is also a little wild. But again, at the same time, you're thinking there's a financial cost here of do we get multiple hotel rooms and all of that, or do we just kind of, okay, this is just how it is. This
One
is
big happy
how,
family. Yep.
yeah. And you know what? Everyone did great. It was fine. You know, you sleep as good as you're going to in a hotel room anyways. So it was, I think, very healing for everybody. And the sweetest part is that Josephine was so proud. She would talk to her sisters like, this is my hospital.
Oh,
And
cool.
this is
Oh, I'm
what,
gonna cry. That's
I mean,
so
it,
touching.
and you just let them connect in their own way. Half the time we don't even have to talk. They have this dialogue of what's that band-aid for? And they're curious and she can talk and mostly answer all the things. And it's very sweet. And so my hope is that over time, they stay connected as much as they want and really support her in the ways that she needs as she ages through this. In a lot of ways, it's getting easier, but we're also hitting the age where she knows now, right?
Mm-hmm.
She, like you were already alluding to a summer. I mean, she knows when we're driving to the place to get labs drawn
Yep.
almost every month right now. Like,
Yep.
and we've worked on a lot of techniques and it has just gotten better and better and better. It's still hard and there's always tears, but we've gone from like really bad to okay, she can do it.
The very first labs Summer had to get when we got home from basically 14 months of living in Boston and Chicago, the very first labs, we almost got admitted. Her cardiologist came in, took one look at her, and he goes, I don't like the way she's breathing. I was like, can we please turn the lights off and let her lay here and collect herself for a half an hour? And then
Yeah.
if she still looks this bad, I won't fight you. We'll admit her, but can we just please see if she can recover herself?
Yeah.
And she did.
Good.
I'm curious, you said close to monthly. We're begging, like, can we please go to 5 or 6 weeks?
Yeah, it's been an interesting journey with hers. And, we went a long time actually on nothing. We're back on zero after the stents were replaced. So again, it felt like another, oh, we didn't have to do any of this for so long. And this feels a lot
Zero,
heavier.
zero bad, no zero good.
Yes.
Yes.
And we actually had a lot of trouble getting her levels in a good range. The most frustrating of this sort of last year for her, she's been doing phenomenal, right? Like no symptoms, no anything. Like, so that's great. But we've had this drug level be a thing. We're actually going tomorrow for lab. So
We
that's
got to
always
do
fun.
two, we got to do labs twice this month, so the
Yep.
level was too low. And then, okay, we're increasing the level, so you got to recheck it after a
Recheck.
week or
Yep.
two. Yep.
Yep.
Yep. I hate having to turn around and do labs so quickly after. She still has a bruise from the
Yeah.
two
From
weeks ago,
before.
right?
Yep. Yep.
I was gonna pivot you on topics because you started talking about Josephine talking to her sisters, and
Mhm.
you and I have spoken before about the developmental toll that it takes on the parents and how do you navigate all that and developmental issues, whether it's the feeding or the talking or the walking or like pick your developmental issue. I feel like Josephine was similar to Summer in that you've had to buy off a lot of different types of therapy. What did that look like when did you first get plugged in? Was it inpatient? For Summer, it was kind of early, a little bit inpatient, and then kind of escalated. Our county stepped in and said, sign up for birth to three, which is our early childhood.
Yeah, yeah, that's a good thought. I want to say her initial surgeries and stuff like PT and OT and all them, they probably had to come in and do a whatever eval. But I guess once we got home from surgery and she was like 3 months old or so, that's when that all started. Now, that's also a little part to our story that's unique. So, my mom is a pediatric PT and worked in our Babies Can't Wait system for her whole career. So, of course, I had her do her physical therapy because she was over often, anyways. And so, my
Can I
mom
just
did,
add something too? Because I feel like if you are a pediatric NP, your mom is a PT who worked with kiddos, right? Like the fact that you still struggle somewhat through this journey makes me feel like, okay, I'm not crazy. This is really hard.
yeah. I mean, my family's saturated in medical providers. My dad's a physician. My is an OT in pediatrics. My brother is an anesthesiologist. Like, it's all there. And it's funny because as she was getting diagnosed and all that, basically all of them were like, we don't know anything about this. And maybe it was a blessing. I always say I have enough knowledge on the medical side to ask really good questions, right? And I had connections in a way of finding a GI doctor that I knew specialized in feeding, but more specifically helped specialize in getting kids off of tube feedings.
I don't recall. Josephine did not have a J tube, correct?
Correct.
She went from NG to G.
Yes.
Remind me again, she's still have her button, or has that
She does
been,
not.
she does
Yeah.
not? Okay. So yeah, I don't know too many other families that escalated all the way to J. Likely for in Summer's case, and the one other little girl I know that also had a J, that was probably driven more by the degree of pulmonary hypertension they had in relation with the PVS, but we've been trying to work off of the J. And if your kid needs a J, please do it. Like I'm a big proponent. Like I think it was definitely a life-saving measure for Summer, but getting your kid off of tube feeding is hard, and then add J into the mix. So now you're that far removed from oral
Right.
eating. It is the fact that you had somebody that you could go to that was GI and a tube weaning expert, like
Oh, it
that's
was amazing. It honestly, and we had worked together. We had crossed paths in the hospital, her as a resident and me as a nurse. And so it was a familiar face. And so I was able to ask a lot of questions that I didn't feel like anyone else was really entertaining. Man, that is tough because what do we have control over at home? Feeding them,
yep,
right? That's
yep,
it. That for a while, that's it. And of course, doing all the therapy. So I think I advocated for feeding therapy very early on. And gosh, that first year, it was just oral stimulation, basically, of keeping things in her mouth so she wouldn't totally reject it. But she didn't swallow a thing until after a year.
yeah,
But her initial swallow study was fine at the very beginning. Like they didn't feel like she was aspirating, there wasn't an anatomical issue. And that gave me the confidence that I knew she could probably do this. She
yeah,
could probably eat by mouth and be fine, but we have to get this heart under control. And then I think she can do it.
yeah,
So I'm really glad I did. Now it was a lot of work and all that. Through Babies Can't Wait, we had a therapist through there and she would come to the house, which was awesome.
yep.
And then, of course, had my mom coming to the house. And so that was pretty much that first year and a half was just a lot of feeding and PT with some OT in there too. And we sort of switched over to speech therapy when she kind of got to the age where she was speaking, but it was not very clear. It's just sort of her normal to work on all of those skills over and over and over. And it was such a beautiful day when we got to graduate from feeding therapy. Like,
Yeah.
I mean, I actually always thought it was going to happen. So I will say that. But there were days where I doubted it.
We're really struggling. We're grinding teeth, we're licking hands, we're looking for those sensory inputs.
Mhm.
And I do question if there's enough people in the OT and development space that really quite recognize how much medical trauma these kids go through. I mean, Summer only had one open heart surgery. We're on 21 cath interventions.
Yeah.
There's like a whole sensory part of OT that
Yes.
she got a little bit of touches of it here and there,
Mhm.
but we've really, that's our focus now. I think it's very challenging to address that.
I do too. Yes. And, back to the siblings thing, we always say the siblings have been her best therapy.
Yeah. Yep.
And that's just, we didn't plan that
Yep.
birth order and all of that. That's just how it happened. And my mom always said that, use them, not in a like put them to work way,
Right.
but in
We're not talking
a,
about child labor or
no,
anything.
no,
Yes.
but that we could, again, set up our environment where they're playing with a certain thing. And guess what? Josephine's interested.
Yep.
They are just, they're so empathetic toward her in ways of, they could see when there's a struggle, right? And they're the ones like coming up and helping her to do this or that. And sometimes almost too much, right? Like,
Yeah.
no, she needs to do stuff on
Let
her
her do
own.
it. Yep. So Summer's turning 3 on Saturday, and we aged out of our early childhood program. We are being entered into the school-based program. So, families, very likely, if your kid has severe PVS, you're going to enter into some sort of individualized education plan. So the school came to us and they're like, okay, Summer's entering into school-based programs, and we have a wonderful 3-year-old special education program. And I'm like, I don't want her to be in special education. Like, she needs to be with kids that are more advanced than her so she can rise up to whatever she's supposed to be capable of, right? And then a week later, we were at outpatient therapy. OT walks in with this little girl. She doesn't speak, she's not walking. And Summer crawled up partially because one of the therapist's assistants always sings to Summer and Summer likes to, ask her for songs. But seeing Summer engage with this other child, I just realized like there's a huge appetite within these kids for empathy and compassion that I think I had underestimated the value for Summer to be the healthier kid in a scenario. And that's part of her development too. I mean, all this developmental stuff is so that they can enjoy a quality of life, right?
Yes. And every year it seems that maybe there's a shift in their higher need of which therapies or what to focus on. The confusing part there is, okay, who's really picking up on that and who's really making
Mm-hmm.
sort of the decisions there? And ultimately, I do think as their parents, we're the ones, but we don't always have the tools or the questions or the even just the confidence to advocate for that. And I do hope that as families connect more in the PVS community, that those are the things we can learn from each other.
Yeah. It's hard when you're in it. I'm kind of beating myself up right now, going, how could I have not seen all these OT sensory needs, right? Like, I have no experience in this and like nothing to base this on, but you know, you can't do everything at once. And I think the thing I'm learning right now is she's going to present what she needs when she needs it. And she might have to hit me over the head a couple of times. And you might have to hear it a few different times from a few different providers. But I think there's a good point to transition the conversation into talking a little bit about Lady Josephine. You touched on how beneficial it is to have other families that maybe a little bit ahead of you that can say, yeah, I hear you, I see you, here's what we experienced. And there's a lot of power in that. And now that Summer is older, I'm enjoying being able to offer that to others to say, yep, we went through that. We went and got the second opinion. We've done the things.
Well, and I think we knew after going through our journey for probably the year and a half is when that kind of came up of what if we had more of a PVS community? What if we were more engaged with the doctors, not just about Josephine, but about this whole PVS community in the medical field? A lot of what ifs. And we just realized, okay, we have a choice and we can go with what we feel like we're being called to do of creating this, or we're going to do what she needs. We're going to love her and support her, but we're not going to have community. And then we thought for her, what does this look like when she gets older? What if she needs more community? What have
Mm-hmm.
we done to foster that? And then it very quickly became we needed it. We
Yep.
needed that as part of our journey. And as
Healing.
healing, yes, healing, grieving, all the things. And so I think when we really looked at it, it was like, okay, this will be challenging, but her life has been really challenging. And this is our opportunity. We don't know what it's going to look like. We don't know, but that's not the point, right? We just have to just open that door, take a few steps, see what happens. And we're still trying to figure it out, right? We're trying to figure out, okay, what is the need and the problem and how can we be a part of the solution? And so we know that obviously, like we've already alluded to a lot of times here, just community, right? Just connecting. A lot of that's going to be virtually because we're sort of all scattered. But gosh, what if in 10 years there's an actual in-person meetup? That would be wonderful. And our kids would be older and be able to connect with other kids. But I think it's just awareness as well. You can look at it very broadly, awareness of just the diagnosis in general. And our hearts were so heavy to think that a kiddo could not get the care that they need and deserve because there was a lack of information about where that could happen. And so that was really a big driving factor. But what plays into that is the financial aspect of getting to the place that they need to get, right? Because it's not only the travel, we have lived through that, right? It is the time off of work. And in my case, it was staying home for 2 years. That was unplanned and unexpected. And There's so many childhood diagnoses that this is going to happen with, right? I think about cancer patients, that huge just barrier of how do we care for our child and be there for them and keep this sort of normal life. So there was this huge pull to support that family connection to help on the educational side, which also pulls in research, which we didn't know anything about in the beginning. Like, who's studying this? Who cares about it? What's going on there?
The number of parties that are now studying and investing in the facilities that are treating, like there's this huge proliferation that just happened. And it feels like the 3 years since Summer got diagnosed.
Absolutely. Yes. It's really amazing. That can be a little overwhelming sometimes, since a lot of it's sort of over our heads in the sense of just like exactly what's being studied and the terminology and all of that. But a lot of that's what we're working with. Some of the physicians who've really reached out and said, we would love to be a part of helping educate families and maybe go through the research with them in a way that makes more sense, or that maybe is more driven off of questions that families actually have specifically and stuff like that. And so that's sort of all in the works. I think will be helpful for many families that feel like there's that lack of, I just don't know how to get good information that I understand that I can share with my family and friends. So that has been a really cool part of Lady Josephine Foundation, to be able to connect with the medical teams. Again, not about Josephine, but about all of PVS kids. It's actually one big community.
Right.
All the medical
Yep.
team, the cath doctors, the nurse practitioners, all of them being so supportive of what we're trying to do. And this will evolve over time. And that's part of why my husband brought it up a little while ago, that when we first started the foundation, it happens rapidly because we really wanted to host this golf tournament and it was going to be soon. And so, okay, let's get this name and this logo
Yep.
and like, let's
Yep.
do this. And so Lady Josephine Foundation, Lady Josephine was a nickname that we had for her, that we called her for like the first year. And she was just our very dainty little petite sweet girl. And so Lady felt like, it was a perfect little fit. But as she's gotten older, he's just really felt called to maybe protect her in a way of not having her name out there like that. And it is not and has never been actually about Josephine. Like, it
Yep.
is our story, but we've always been in this for the PVS community.
Yep.
And so
She was the catalyst. It has been amazing. You have brought people together. You have supported families. You have sort of supported research. And now you have this beautiful story to tell of your origins and
yes.
now how you envision the future. Because I remember when we first got introduced to Lady Josephine, I think it's worth sharing. Currently you have the capacity to support families from 3 facilities, Boston, CHOP, and Atlanta.
Mhm.
And we were introduced to you and Ben. I had been laid off, and Lady Josephine was introduced that way. You guys kindly sent us money to help us with some of the bills. It's a lot for families to take this on initially. But as we got out of that stage, I was excited to hear you guys expanding your scope. Like, okay, what are we really trying to create here? The sense of community. Okay, some of that is financial support, but some of it is just making connections and connections to the research and helping fuel the research that is going to change the trajectory for these kids.
Yes. Yeah. And that's really well said. The financial part, this is just an expensive disease for most families, right?
Yep.
I mean, yes, insurance is wonderful and obviously covers for most of us the larger chunks of the medical bills, but that just doesn't play into a parent not working anymore, relocating for a bit, those sorts of things. That burden that you carry, all while thinking, I just want to be there for my kid. And I have to just physically be there with them. And that comes at a cost. And that's the thing, is we don't know the stories, right? Like, our sort of motto with Lady Josephine Foundation is fostering hope. And for a little bit, it was like, well, what does that mean? Because you might take that as, oh, we're going to help heal your kids and cure this disease. And in the long run, that sounds like an amazing goal, right?
Yep.
That's going to take time. That's where the research plays in, and supporting families so that they can get the best care, so that we can all continue to learn about PVS and how to treat this better, and so on and so forth. Like, how can I be in all these different places? How can I always said, I would be the most reliably unreliable employee ever. Like,
Yep.
of just,
Yep.
sorry, we're having a crisis. We're back in the hospital. I can't come in this week, maybe for a month. I don't know,
Right.
I
I
mean,
mean, I'm so blessed that my career is one that I started doing freelance work, and I've had 3 or 4 really great gigs at this point. They know my situation and I'm able to navigate that. But one of the things that really gives me hope too, you talked about you and Ben out there speaking with these physicians who want to share the knowledge with the families. But I also think there's the reciprocated side of that, which is I always think the community benefits from you and Ben out there speaking with physicians and clinicians too, because I think the more that they hear and see our journey, there's a huge benefit. Because I think the feeding part of it is definitely underestimated in terms of like how much that impacts us as families and the development stuff that you and I talked about. We are lucky as a community because Ben and Liz are out there having these on the ground conversations, at least at CHOP in Boston and Atlanta.
oh, no, thank you for that. We're trying to pave a path. I think over time that it will open up to the community, and that we're all going to be able to have a voice in this. The teams that we've connected with have been so supportive of us on our personal journey, but also on this journey of actually creating this PVS community. None of this would happen if that wasn't the case, for sure. And I'm so excited to see where it goes, which I don't think I actually said, but we chose a new name. We kind of knew having PVS in our name was important because it just really called attention to us as a community and what we are all about. So PVS Warriors Foundation is what we will transition to.
Clap
And
now,
again,
yes.
yay.
Yay.
So we're excited. I think it will help to define that community a little bit better, and we hope that there's just feedback too of just how can we be supportive of each other and what do we really need. I mean, there's only 2 of us, so that's why we're sort of limited in our scope, especially on the financial end. But I don't think that limits us in connecting the whole community and all of the PBS families and sharing information and all of that, which, we're sort of working on that website part of it, of building that up and figuring out how to make things just easier to find, right? Maybe a home base for some basic stuff, especially to share with other family members when you're trying to explain what this is and how impactful it is on our families.
There is no other organization that is solely focused on PVS, supporting PVS families, supporting PVS research, taking what little energy you might have had at the end of the day, still battling this disease, to put forth in this amazing way that you're contributing. And I hope that in our lifetimes, in our daughters' lifetimes, even if there's not a cure, maybe life is a little bit easier for families because of the work that you do. So thank you.
Yeah. Oh, thank you. And that, I mean, you said it really well in the end. We hope that other families can feel supported and feel hope. And I know that's going to look a little bit different for everybody, but I think when we can have a conversation with someone in a way that feels more connected, that can just change your whole outlook on this. We have just taken it and we're going with it. And we hope that this is just part of that gift to Josephine that we can offer her.
All right, so that's going to wrap up my conversation with Liz Poe. Here's where I'm going to encourage everyone to visit LadyJosephineFoundation.org. Wonderful website, tons of great resources. Liz and Ben are going to be hosting some family meetups this summer to bring together community, like Liz mentioned. So watch for those meetups to be announced there. And again, thank you, Liz, and thank you, Ben, for all you do. And everybody's looking forward to seeing the PVS Warriors Foundation continue to thrive and support families. Thanks for listening.